Two complementary branches of science, anatomy and physiology, provide the foundation for understanding the human body. Anatomy focuses on the structure of body parts and their relationships to one another, while physiology examines the functions of those parts and how they work together to sustain life. Anatomy is a broad field with multiple subdivisions. Gross or macroscopic anatomy studies large body structures visible to the naked eye, such as the heart, lungs, or kidneys. Gross anatomy can be approached in different ways. Regional anatomy examines all the structures in a specific area of the body simultaneously, such as the abdomen or leg. Systemic anatomy focuses on body systems, such as the cardiovascular system, which includes the heart and blood vessels throughout the body. Microscopic anatomy deals with structures too small to be seen with the naked eye. Subdivisions include cytology, which is the study of cells, and histology, which is the study of tissues. Developmental anatomy traces structural changes that occur throughout the lifespan. A subdivision, embryology, focuses on the developmental changes that occur before birth. Like anatomy, physiology has many subdivisions, most of which focus on the function of specific organ systems. For example, renal physiology examines kidney function and urine production. Neurophysiology explains the workings of the nervous system. Cardiovascular physiology studies the function of the heart and blood vessels. While anatomy provides a static view of body structure, physiology reveals the dynamic and active processes that sustain life. The principle of complementarity of structure and function states that a structure's function depends on its form, and its form is directly related to its function. For example, bones have hard mineral deposits, allowing them to support and protect organs. In the heart, blood flows in one direction because valves prevent backflow. Let's review. Question 1. A patient presents to the emergency department following a motor vehicle collision. The trauma team initiates a comprehensive head-to-toe assessment, systematically examining for signs of trauma, bleeding, or other injuries. This approach reflects what type of anatomical approach, systemic or regional? The correct answer is regional approach. A regional approach involves examining and addressing specific areas or regions of the body, such as the head, chest, abdomen, or limbs. In a head-to-toe assessment, the trauma team systematically evaluates the body by regions, ensuring that all potential injuries or sources of bleeding are identified.
Aren't vital signs part of a systemic approach? For example, doesn't blood pressure measure the pressure throughout the entire cardiovascular system? And how does this fit into the trauma team's head-to-toe assessment?
Good question. Let's go over it. When a trauma patient arrives in the emergency department, vital signs are one of the first things assessed. Nurses or other team members quickly measure blood pressure, heart rate, respiratory rate, and oxygen saturation to get an immediate snapshot of the patient's systemic condition. These vital signs provide critical information, such as whether the patient is in shock, has low oxygen levels, or is experiencing other systemic issues. At the same time, the trauma team initiates the primary survey, focusing on life-threatening conditions like airway, breathing, and circulation. The secondary survey, or head-to-toe assessment, happens shortly after and works alongside the monitoring of vital signs. Nurses document and communicate vital sign trends in real time, helping guide the trauma team's regional examination of the patient. So in answer to your original question, yes, vital signs are a key part of a systemic approach. For example, blood pressure measures the pressure within the cardiovascular system as a whole. Heart rate and oxygen saturation provide insight into overall cardiac and respiratory function. Vital signs reflect the systemic state of the body and help identify conditions like shock or hypoxia that require immediate attention. Combined with the regional head-to-toe assessment, they ensure a comprehensive and effective evaluation of the patient's condition. By integrating vital signs with regional assessments, the trauma team can address both the systemic and localized aspects of the patient's injuries or condition. Question 2. During a neurosurgical procedure to remove an unknown mass in the brain, the surgeon sends a specimen to the pathology lab. The pathologist processes the specimen, preparing it for microscopic examination to evaluate the tissue structure and cellular composition. How would you classify this type of examination? Histological or cytological? The correct answer is histological. Histology involves the microscopic examination of tissue architecture. Since the brain mass is processed as a tissue specimen to evaluate its structure, this examination is classified as histological.
But the pathologist also examined the cellular components of the brain tissue sample. Why is this still considered histology and not cytology?
That's a great question. While cytology involves the study of individual cells, the distinction lies in how the sample is prepared and analyzed. Here's the breakdown. Histology focuses on the architecture of tissues, which includes cellular composition, but also examines how cells are arranged within the tissue. For example, in a brain tumor specimen, histology evaluates both the tumor's cellular characteristics and how the cells are organized within the surrounding tissue, giving insights into the overall structure and pathology. Cytology, on the other hand, examines isolated cells or small clusters of cells, typically obtained through techniques like fine needle aspiration or fluid collection. Cytology does not analyze the tissue architecture, but focuses purely on the individual cellular features. In the case of the brain tumor specimen, the sample would typically include sections of tumor tissue, which makes the examination histological because the pathologist is studying the tissue structure and cellular organization rather than just isolated cells. Question 3. Henry VIII of England reportedly suffered from knee swelling and joint pain, with some speculating that his symptoms were due to syphilis in its tertiary stage, while others suggest gout, arthritis, or another chronic condition. If you could evaluate Henry in a modern clinic and perform a needle aspiration of fluid from his swollen knee for laboratory analysis, explain why this procedure is classified as an example of cytology. This is an example of cytology because it involves the microscopic examination of individual cells and other components within the aspirated synovial fluid. Cytology focuses on the analysis of cells and non-cellular elements in bodily fluids. If Henry's swelling were caused by gout, cytological examination of the synovial fluid would reveal the presence of urate crystals. In cases of infection, such as in septic arthritis, cytology would show an elevated white blood cell count, and further testing, like cultures, could identify the specific pathogen. If syphilis were the cause, cytology might reveal general signs of inflammation, but additional blood tests would likely be needed to confirm the diagnosis, as synovial fluid may not directly indicate syphilis. This example illustrates how cytology provides valuable information about the cellular and chemical composition of joint fluid, making it a critical diagnostic tool for joint-related conditions. Question 4. A 37-year-old woman in her second trimester of pregnancy undergoes an ultrasound to assess the fetus for structural anomalies such as heart defects, neural tube defects, or skeletal abnormalities. Which branch of developmental anatomy does this examination relate to? The correct answer is embryology. This relates to embryology because many structural anomalies arise from disruptions in the developmental processes studied in this field. Embryology focuses on the changes that occur before birth, including cell differentiation, tissue folding, and organogenesis. These processes are critical for proper fetal development, and abnormalities can result from errors during these stages. Question 5. A 65-year-old man visits the clinic with complaints of shortness of breath, chronic cough, and difficulty performing daily activities. He has a long history of smoking. After conducting imaging studies and pulmonary function tests, the doctor diagnoses him with emphysema, a condition where the alveoli, tiny sacs in the lungs responsible for gas exchange, are damaged. This damage reduces the surface area available for gas exchange and decreases the elasticity of the lung tissue, making it harder for him to exhale properly. What principle does this scenario highlight, and how does it explain the connection between the structure and function of the alveoli in the lungs? This scenario highlights the principle of complementarity of structure and function, which states that the structure of a body part determines its function, and its function depends on its structure. The alveoli in the lungs are small, balloon-like air sacs with thin walls, designed to maximize surface area for gas exchange. This structure enables oxygen to diffuse efficiently into the bloodstream and carbon dioxide to diffuse out. In emphysema, the alveolar walls are damaged, which significantly reduces the surface area available for gas exchange, impairing their primary function. Furthermore, the loss of elasticity in lung tissue prevents proper exhalation, trapping air in the lungs and further reducing the efficiency of gas exchange. This demonstrates how structural damage to the alveoli directly affects their ability to function, underscoring the interdependence of structure and function in the human body. Let's recap the main points we've covered in this lesson. First, we explored how anatomy and physiology work together to help us understand the human body. Anatomy focuses on the structure of body parts, while physiology examines how those parts function and work together to sustain life. We discussed key subdivisions of anatomy, including gross anatomy, which can be approached regionally or systemically, microscopic anatomy with its focus on cytology and histology, and developmental anatomy, particularly embryology, which studies changes before birth. Next, we examined how systemic and regional approaches are used in clinical practice. Vital signs like blood pressure and heart rate reflect the systemic condition of the body, helping identify critical issues such as shock or hypoxia. These systemic indicators are continuously monitored while the trauma team performs a regional head-to-toe assessment to identify localized injuries. Together, these approaches ensure a thorough evaluation of the patient. Finally, we explored case-based examples to illustrate key principles such as the difference between histology and cytology, the role of embryology in understanding fetal development, and the principle of complementarity, which highlights how the structure of body parts determines their function. For instance, in emphysema, damage to the alveoli directly impairs gas exchange, emphasizing the interdependence of structure and function. These concepts are critical for understanding how the human body operates and for providing effective care.